There's 100 different types of masks out there. There's different manufacturers. There's different materials used in the manufacturing of the masks. Latex is not one of them, just so you know. This is probably the least invasive of all the interfaces available. They call them nasal pillows because you have small little pieces that look like pillows that seal inside the nares. So for patients that feel claustrophobic, that don't want a lot of material or weight on their head, they just have the one strap across the top of the head and the one strap behind. Again, different manufacturers all have their own version of the nasal pillow, but the concept is the same. It's just the one piece in the nose and then the very light headgear. So with this type of interface, the patient has to breathe with their mouth closed. Otherwise, the air would go in the nose, swing around the soft palate, and come shooting out of the mouth. So that's one of the challenges of using anything that doesn't cover your mouth, is that you have to be able to hold it closed. So this is what the nasal pillow looks like. Most of them will have a removable piece that you can pop off and clean every day since it's inside the nose. So the next type of interface that we have is a nasal interface. It covers just the nose. Again, the requirement of holding your mouth closed is still there so that you don't create the big leak. But this type of material will only cover the nose so that the patient can not feel like they have a lot of material sitting on the face. It's the same concept, it just covers it instead of going directly into the nostrils. One of the nice things that they've developed for the nasal mask and for the full face is the magnet technology. So for patients that had arthritis or for ALS patients who have impairment in their hand function, they can use a magnet where if they just get it close, it automatically will click on and then lock into place. So it makes it easier for them to take it off and on. So the last type of interface that they have is a full face mask. With the full face mask, it covers the nose and the mouth. There are some variations to the full face mask where the forehead piece is eliminated so that there's nothing obstructing the view for the patient, so they feel a little less confined. Again, different manufacturers, different models, but the technology and the concept is still the same. So the patient would put the full mask on, connect the tubing, and then they have the ability to breathe out of the nose or the mouth, whatever's more comfortable for them, so that they can receive the benefits of the therapy. One thing that we have noticed with full face masks, even though you have more that physically sits on your face, it actually can feel less confining because as the air comes in, it disperses into the mask like a fan almost, and it makes it easier for the patient to tolerate because it's not such a direct pressure. So when you decide which type of interface that you want to use, there's a couple of different things that you take into consideration. A large majority of patients like to start with the nasal pillow just because it's the less is more theory. So you have less on your face, it's a little less invasive, gives you the opportunity to get comfortable with the equipment. A large portion of patients will eventually end up in a full mask that covers the nose and mouth, just because it gets more difficult to control your chin and those facial muscles that you need to keep closed during sleep. When I set up a patient on therapy, the one thing that I like to do is, if we're in the bedroom, have them actually lay down with the equipment and the mask on. And I tell everybody, adjust the headgear when you're in the position that you sleep in the most. Because if you lay on your right side or your left side, whichever side is down is going to need less tension to hold it in place versus the other side where you need to apply the extra tension to hold it in place. All of the masks and interfaces are interchangeable when you're dealing with the sleep or the respiratory type equipment. So the bilevel, BiPAP, the Trilogy, any other manufactured machine, all of those interfaces are interchangeable and will provide the same therapy, just a different delivery.